and the introduction of the Lyme Rex vaccine. And since then, all the procedure around the formulation of these ICD codes has gone dark.
Same phone.
Yeah.
Oh yeah, switch.
Go, Jenna. Tell it.
My phone is dying. Like, I need to have somebody else.
So in June 2017, an international group, including American representatives, we met with the Special Rapporteur for Health Human Rights, and the following human rights violations against Lyme Borreliosis patients, as well as Relapsing Fever Borreliosis patients, went formally onto UN record. And these are the human rights violations that are on record. The prevention of proper diagnosis and obstruction to access to treatment options that meet internationally accepted standards. These include the denying of Lyme screening requests made by pregnant women and deny treatment options to pregnant women who have Lyme infection, infections proven to be crossing the placenta and causing severe negative outcomes to babies, including miscarriage, stillbirth, and sudden infant syndrome, death syndrome.
Thank you, Jenna.
They are also promoting discrimination based on the type of manifestation or symptom that you show. There are so many symptoms that are not recognized, so many complications, that if you don't have the few that are listed by the IDSA and the CDC, you are discriminated against. They prevent proper diagnosis and obstruct access to treatment options. They restrict information regarding the availability of treatment options that meet internationally accepted standards. You are not getting your informed consent. They obstruct treatments towards illness manifestations that are not included in the current codes. For example, if you have a Lyme-like neurological complication like a Parkinson'sism, you will not be able to get that diagnosis and adequate treatment for that complication. These codes and these practices and policies support attacks on our human rights defenders, and these include medical practitioners, scientists, and researchers, including the parents of all of us who have kids who are sick. You are all human rights defenders.
Amen.
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 These practices routinely exclude the key stakeholders, such as the medical practitioners, the patients, the caretakers, who are concerned with persistent and complicated cases of Lyme borreliosis. They exclude us from decision-making venues, or they have sham decision-making venues like the current Federal Tick-Borne Disease Working Group.
Vaccine working group.
And they make these stakeholders invisible to policymakers, economists, and other practitioners and researchers. They misapply psychosomatic disorder diagnosis and deny care for biological illness in lieu of medical diagnosis and care for biological illness. Sick children receiving treatment that meet internationally accepted standards are forcibly removed from their parents, who are then falsely accused of criminal acts, such as poisoning their children or Munchausen by proxy. And then there are also alarming cases where euthanasia is encouraged over therapies that meet medical criteria. And this is happening in many, many different countries.
Murder.
The following medical conditions also went onto UN record, and these, most of them have not been recognized by the CDC or the IDSA. They include congenital Lyme disease, persistent infection, Borrelia lymphocytoma, granuloma annulare, morphea, localized scleroderma, lichen sclerosis and atropicus, Lyme meningitis, Lyme nephritis, Lyme hepatitis, Lyme myositis, Lyme aortic aneurysm, coronary artery aneurysm, late Lyme endocarditis, Lyme carditis, late Lyme neuritis or neuropathy, meningovascular borreliosis and neuroborreliosis with cerebral anthrax, intracranial aneurysm, Lyme Parkinsonianism, late Lyme meningoencephalitis or meningomyeloencephalitis, Lyme meningoencephalitis with dementia, subacute presenile dementia, neuropsychiatric complications and manifestations, late Lyme disease of the liver and other viscera, late Lyme disease of kidney and ureter, late Lyme disease of bronchus and lung, seronegative and latent Lyme disease unspecified. These are all on record now.
Praise
Thank
God.
you.
Thank you.
And this summer, there are going to be more violations and more health complications going into UN records. So what is the right to health when we talk about that? When we talk about human rights and the right to health? The right to health, like all human rights, imposes upon the state, meaning the government, 3 types of obligations. Respect. This means simply not to interfere with the enjoyment of your right to health. That means they should not be obstructing your right to care. They should not be interfering that. That is a basic right to health. Protection. The government is supposed to offer protection. This means ensuring that third parties and non-state actors do not infringe upon your enjoyment to the right to health. That means the IDSA has no right, no human right. It's a violation of our human rights for them to obstruct our access to care and to limit the types of treatments that we get. Fulfill. This means that they must take positive steps to support our right to health. It is heavy.
Look at our little Lyme warriors. So precious.
What does it mean when the government has to fulfill and support our right to health? It means that the government must address the health concerns of the whole population. This must be done on a participatory and transparent process.
Transparent.
Dr. Heller?
Where's Dr.
Anywhere?
Heller?
Tick-borne disease working group, are you listening? It must have measurable indicators and results. In other words, they can't just say we're going to help you. They're going to say exactly how they're going to help you.
Yes.
And it should be monitored in a way that can be, the progress should be monitored, and there should be, and this is part of the human rights, it's very important, particular attention to all vulnerable and marginalized groups. And in this context, it is important to distinguish the inability of government to do something from the unwillingness of the government to comply with its right to health obligations. And we have a government that is unwilling. So human dignity is the basis of fundamental human rights. It is inviolable and it must be protected and respected. The dignity of a person is a fundamental right in and of itself and constitutes the basis of all human rights.
Amen, Jenna, get him.
And it is codified in international law and in our Constitution.
Amen, yes.
The situation of Lyme and relapsing fever borreliosis patients and their defenders show violations in the 11 human rights treaties. The violated human rights of Lyme patients include the right to liberty and security of person, the right to confidentiality and privacy, meaning your records, the right to information, meaning informed consent, the right to bodily integrity, the right to life.
That's right. That's
The right to life.
Tell us, Jenna.
The right to the highest attainable standard of life and health. The right to freedom from torture
That's right.
and cruel, inhumane, and degrading treatment that so many of us have experienced when we go in to the regular medical establishment. We are treated without respect, we are humiliated, and we are treated in a very degrading and disrespectful and sometimes a torturous manner. Withholding care, medical care, is a form of torture.
Yes. Amen.
That is undeniable. The right to participation in public policy, like the current sham of the Tick-Borne Disease Working Group. The right to non-discrimination and equality, and the right to a remedy. Meaning if something bad happens to you, your legal system should support your ability to right a wrong. The human rights violated of our human rights defenders include also the right to freedom from torture and cruel, inhumane, and degrading treatment, the right to decent work conditions, the right to freedom of association, the right to participate in public policy, the right to due process when their licenses are removed. They have a right to process. They do not have currently, they do not have an unfair and unbiased system, and a right to remedy.
Amen.
Yes.
Yes.
I'm almost finished.
Yeah, you're doing great. Thank you.
So far,
Thank you.
great.
Thank you.
Can somebody squeeze the button for her?
Yeah.
So I'm going to just read to you the names of the 11 international and regional treaties that are being violated every day for those of us suffering from Lyme and relapsing fever borreliosis and co-infections. The number one is Convention Against Torture. And then the European Convention for the Prevention of Torture and Inhumane or Degrading Treatment or Punishment. Because, you know, this is a global epidemic. It's a pandemic. The Convention on the Elimination of All Forms of Discrimination Against Women. Women face particular forms of discrimination against women, as well as women who are pregnant and can't get tested and won't be treated for their unborn children. The Convention on the Rights of the Child. Our children's rights are being discriminated against. Convention on the Rights of Persons with Disabilities. People who are disabled by this disease are not provided the support that they would give to any other patient group that's disabled.
Right.
The African Charter on Human and People's Rights. The European Convention on the Protection of Human Rights and Fundamental Freedoms, meaning freedom to access health care. The European Social Charter. The International Convention on Civil and Political Rights. The International Convention on Economic, Social, and Cultural Rights, Article 12, to reduce infant mortality and ensure the healthy development of the child, to improve environmental hygiene, prevent, treat, and control epidemic, endemic, occupational, and other diseases, create conditions to ensure access to health care for all.
Yes.
The International Convention on the Elimination of All Forms of Racial Discrimination. The right to liberty and security of the person has been held to prohibit unauthorized disclosure of personal health data. Do you know that there are legislations across many different states where they feel that they should be able to access your data on Lyme without, every time a doctor, they try to take the license away from a doctor, they go into that doctor's office and seizes all of your medical records, and it is widely disseminated and used without your permission.
That's wrong. That's wrong.
The rights of bodily integrity and the security of the person have been held to prohibit the administration of medicine to a child against parents' wishes. Parental rights in the care of a child are routinely violated. And not only prohibiting the administration of medicine, but withholding medicine to children.
Right.
The right to freedom from cruel, inhumane, or degrading treatment or punishment has been held to oblige governments to secure the adequate health and well-being of prisoners. And you can imagine how many prisoners also are going without any diagnosis and care. Just a page and a half now.
All right.
We
You're
love
doing
you,
great.
Jenna.
We love
Keep
you.
it
Thank
up.
you for
Everybody's
sharing that.
commenting. More.
So, before I get into this last part, I just want to say that these reports that I'm putting into record on the United Nations are considered official documents, and the first one now is already being used in the law case against the IDSA out of Texas.
Woo! Go, Jenna!
It's very important to actually document this and put it into official record, because it can be used in lawsuits, and it can be used when you're trying to defend yourself to your insurance company. But people need to know about it. They need to